Dots back a day after deep cleaning? It's not dirt, it's oxidized oil sealed under dead skin. Today I'm running S8 Ice FY, a gentle but ruthless routine that melts plugs, lifts them cleanly, and keeps pores calm. The S8 Ice FY TM map: soften, absolve, oil melt, targeted acids, enzyme swipe, short clay pulse, friction-free release, yield and protect. 2-3 min warm towel steam on nose sides, chin to loosen oxidized sebum. Warm, not hot. Optional, soak towel in green tea, soothing. Heavy SPF makeup today? Quick micellar swipe first. Oil cleanse 60s on dry skin, creases, sides, tip, chin. Emulsify milky rinse. Gel foam cleanse 60s with heart leaf or green tea or mild BHA to sweep inside pores without stripping. Glide check. If skin feels squeaky, swap to a gentler gel. Squeak, barrier stress, rebound oil. Blackhead map, nose, sides, chin. BHA 0.5 to 1%, 2-4x week PM. Press product onto the zone. Oil soluble, dissolves in pore plugs. Cheeks, jaw, sensitive. PHA, LHA, or low lactic 1-3x a week for a low sting smooth. Skip acids on retinoid night. No gritty scrubs, micro tears, monks easier reclogging. 1 time 2x week. Mix a pinch of papaya pineapple enzyme into your cleanser. Massage, MOD45s, then rinse. Goal: nibble off the dead cell film that traps oxidized oil, not to over-exfoliate. T-zone only, 6-8 mean, kaolin, bentonite, plus splash green tea. Rinse at 80% dry before it turns chalky to avoid dehydration and rebound shine. We now arrive at the delicate step. Optional, friction-free release. Only attempt this after your pores have been softened by steam or a clay mask. Cleanliness is non-negotiable. Sanitize your comedone loop with isopropyl alcohol and let it air dry. We advise against using fingers, but if you must, wrap them in fresh tissues for each site to prevent transferring bacteria. Remember, the goal is release, not assault. For blackheads, use the lift and roll technique. With the thin wire loop, stretch the surrounding skin taut. Place the loop slightly past the pore, then with gentle, even pressure, roll the tool back over it. The goal is to coax the contents out from below, not press them down. You should feel a clean release, not a painful scraping. For mature whiteheads, the Q-tip cross-compress method is safer than fingers. Hold 2 cotton swabs at a 45-degree angle on either side of the blemish. Gently press inward and then slightly upward, creating pressure from the base to encourage the contents out. Never squeeze the swabs together, as this can rupture the follicle wall underneath. Adhere strictly to the rule of 2s. If the impaction doesn't release after 2 gentle attempts, you must stop. Your skin is communicating that it isn't ready. Further force will only cause trauma, inflammation, and potential scarring. It is always better to leave it and treat it topically. And be clear, some things are never for DIY extraction. This includes deep cysts, hard milia, or stubborn ingrown hairs. These are not surface-level issues and require professional intervention to be resolved safely. Attempting to force them will only lead to significant damage. Immediately after a successful extraction, aftercare is crucial. Gently dab a touch of salicylic acid onto the empty pore to disinfect it. Next, calm inflammation by gliding a chilled ice roller over the area for 30 to 45 seconds. Finally, apply a hydrocolloid patch. This creates a clean healing environment and prevents picking. Now, we yield. After the active release phase, your skin craves calm and replenishment. This step is about soothing inflammation and beginning the healing process. Start with a hydrating toner or essence. Look for calming ingredients like Centella asiatica, heartleaf, or panthenol to reduce any immediate redness. Dispense a small amount into your palms and press it gently into the skin. This pressing motion is less disruptive than wiping and ensures maximum absorption, delivering a wave of hydration without friction. Next, a targeted treatment. The key here is to choose only one. Overloading freshly treated skin can lead to irritation and compromise your skin barrier. Apply a very thin layer, just enough to cover the target area. If your primary concern is oiliness or congestion, a niacinamide serum at 4 to 5% is an excellent choice. It helps regulate sebum production to balance oil and visibly refines the appearance of pores over time. If you're prone to post-breakout marks or persistent redness, apply a gentle azelaic veil over the affected zones. This powerhouse ingredient helps to calm inflammation and fade the red or brown marks that spots can leave behind. For an active, inflamed whitehead, use a spot treatment. Apply a tiny dot of 2.5% benzoyl peroxide directly onto the blemish only. If you're sensitive to BP, a sulfur-based treatment is a fantastic, gentler alternative. Now, seal everything in. A lightweight gel moisturizer is ideal. Look for formulas with ceramides to repair the skin barrier and hyaluronic acid for hydration. Properly hydrating the skin prevents it from overcompensating with more oil, a phenomenon known as rebound oiliness. This creates a protective, breathable shield. Finally, the most critical step for your morning routine: protect. Always finish with a non-comedogenic sunscreen of at least SPF 30. UV exposure not only slows down the skin's natural repair process, but also darkens post-inflammatory marks, making them harder to fade. This final shield is non-negotiable for healing. Night A, BHA Zone Press. Soothe, Gel Moisturize. Night B, Retinoid Adapalene Pea Size, Whole Face. Moisturizer, normalizes shedding, fewer future plugs. Night C, Recovery, skip strong acids, barrier serum, plus gel. Don't stack retinoid plus strong acids plus benzoyl peroxide in one night. Pillowcase 2 to 3x week, phone wipe daily, cleanse within 10-15 min post-workout. Wash brushes weekly, avoid heavy occlusives on the T-zone. Hands off, if you want to touch it, patch it. The results of this gentle, consistent approach speak for themselves. On the very same day you begin, you'll notice a significant reduction in surface redness and irritation. Your skin will feel calmer, less reactive. Those stubborn plugs, especially on the nose and chin, will appear cleaner and feel softer to the touch, primed for the gentle release process we've established. This isn't about harsh extraction. It's about preparation and patience. Within 7 to 10 days, the textural changes become undeniable. The skin on your nose and chin will feel remarkably smoother as the S8ISFY TM method begins to regulate sebum and prevent new impactions. You'll see fewer of those fresh, dark dots appearing, a clear sign that you're interrupting the cycle of blackhead formation at its source. By week 4, the transformation is clear. Consistent use of the method and your nightly rotation establishes a new, healthier baseline for your skin. The blackhead cycle is visibly reduced, pores appear refined, and your complexion looks balanced and clear. This is the power of working your skin, not against it. If you're feeling inspired to start your own journey tonight, drop a in the comments. I'd love to hear from you. For a more personalized touch, share your skin type and your toughest zone, whether it's the nose, chin, or jawline, and I'll pin a custom mini-map to help guide you. Your engagement helps build our community of smart skincare enthusiasts. Please like this video, share it with someone who might find it helpful, and subscribe for more tutorials on barrier-safe deep cleansing that actually delivers lasting results. Thank you for watching.